Welcome to the ENT Uplifter course. In this video, we shall talk about the blood supply of nose. We shall talk on this topic under the headings of why is it important for us to know about this and what exactly is the arterial supply of the septum, the arterial supply of the lateral nasal wall, the venous drainage and applied anatomy. So blood supply of nose is an important topic at an undergraduate level. And why is it important? It's because epistaxis or bleeding from nose is a very common problem in ENT OPD. We frequently get patients who are young adults or kids who frequently pick their nose and come with nose bleeding. We also find a lot of patients who are elderly or who are middle-aged who come with epistaxis due to blood pressure and other things. So it's a very common thing and you need to know the vascular anatomy of nose to adequately control it. Only when you know the vascular anatomy, you can properly identify the cause and the site of bleeding, as well as the planning of treatment can be done. So if you know it properly that it is coming from one particular area and this is the artery that is causing it to bleed, then you can precisely treat it with proper knowledge. So for this purpose, it is imperative that we know the vascular anatomy of nose. So now moving on to the arterial supply of septum. So talking of the arterial supply of septum, you need to remember 5 arteries. You have an anterior ethmoidal artery, a posterior ethmoidal artery. So these come from the top, one anterior and one posterior. Then somewhat, more posterior, you have your branches of sphenopalatine artery. That's the third. Then inferiorly, you have this septal branch of superior labial artery and septal branch of greater palatine artery. So these are the 5 arteries: anterior ethmoidal artery, posterior ethmoidal artery, sphenopalatine artery, greater palatine artery, and septal branch of superior labial artery. What else you need to know when you discuss about the blood supply of septum is an area called the Little's area, where you have a plexus of arteries called the Kieselbach's plexus, formed by the anterior ethmoid, branches of the sphenopalatine, septal branch of greater palatine, and septal branch of superior labial. After knowing these 5 arteries, this is the basic. The next thing that you should know is what are they, where are they coming from, like what are the branches. So the anterior and the posterior ethmoidal artery arise from the ophthalmic artery, which in turn arise from the internal carotid artery. So you must remember the 2 arteries on the top, or those come from the roof. The anterior and posterior ethmoidal artery are branches of the ophthalmic artery, which is in turn a branch of the internal carotid artery. The other 3 arteries, namely the superior labial, the greater palatine, and the sphenopalatine, are all branches of the external carotid artery. So the external carotid artery branches off from the facial artery, which gives a superior labial branch. Labial means lip. So this is the superior labial artery. From that, a branch goes into the septum and that supplies this area. Now you have your septal branch of greater palatine artery, which comes into the nasal cavity through a canal. So this is a branch of the maxillary artery, which is in turn a branch of the external carotid artery. Maxillary artery also gives branches, also gives off a branch called the sphenopalatine artery, and the nasopalatine branch or the medial nasal branches of the sphenopalatine artery, they supply the septum. Now this same picture can be beautified in some ways. So whenever you draw a picture in your exam, make sure you draw it in the middle of the page and you label it in such a way that the lines don't cross. You label it in such a way that it's spread out all over in a nice way. And let it not be oblique. Whatever you write, let it be straight. So here you can see that all the labels are away from the diagram. They do not, impinge or overwrite on the diagram that has been drawn. This itself is neat, but if you have some time, if you still want to beautify it, a very minimal use of colors can help. Like for the arteries, you can give just a red line on top of it, and just on the bones, you can just put some yellow color. So here you have a bone, and this is also a bone, so here you can just put some yellow color. And that's what I have done here in this picture. It's the same picture, but I've just underlined here a bit the internal carotid artery and the 5 arteries that we spoke about, and the external carotid artery. And then I've just put a red line on the arteries, a red sketch pen, and I've used a yellow sketch to slightly give color to the bones. So this adds a lot of, it brings attention to your answer paper, and definitely you will get half a 1 mark more for this question if at all they ask this. But make sure that colors are allowed in your exam. You should make sure that that is also not going to give you any negative marks. So that's about the blood supply of the septum. Now let's talk about the blood supply of the lateral nasal wall. So you know that the lateral nasal wall of nose has mainly three turbinates, the superior, the middle and the inferior. You just have to draw like this. And again, similarly, you have your anterior ethmoid and the posterior ethmoid, which come from the roof. One is anterior, the other is posterior. Then again, you have your sphenopalatine artery system, and it gives off two branches, like the posterior lateral nasal branches. Then you have something that comes near the vestibule, that is the alar branch of the lateral nasal artery, and also some branches from the greater palatine artery. So as we know, the internal carotid artery gives off a branch called the ophthalmic artery, which gives off two branches, anterior ethmoidal and posterior ethmoidal artery. They come like this. The sphenopalatine artery is a branch of the maxillary artery, and so are greater palatine and lesser palatine arteries. They are all branches of maxillary artery. The lateral nasal artery, which gives off an alar branch which supplies the vestibule, is a branch of facial artery, and the facial and the maxillary are branches of external carotid artery. Now again, I have just beautified the same picture in the next page. You can just have a look. It's just a matter of time. If you have the time while revising, just take two color pens. Arteries are red, and anywhere you see bones, put a little bit of yellow color, and it adds a lot of value to your answer, to the picture. We shall be uploading the notes of these things in our notes section, so you don't have to worry. Now moving on to the venous drainage of the septum. So these arrows denote the direction of blood. So these are, the ethmoidal veins, the anterior and posterior ethmoidal venous system. The blood drains like this in upward direction, and it goes into the cavernous sinus, that's in the cranial cavity. Now in this anteroinferior area, the blood drains into the facial vein, and more posteriorly, the blood drains into the pterygoid plexus and infratemporal fossa. And when you move towards applied anatomy, you need to know what is Little's area, what is Woodruff's plexus, and what is retrocolumnar vein. So again, the same picture has been slightly beautified, like you put a little bit of yellow tinge to the bones wherever you see, and the blood vessels or the veins are colored in dark blue. The idea is to draw in a, directly you use a black pen to draw this thing. So for this you need some practice. Unless you practice, you won't be able to directly draw using a black pen, because if at all anything goes wrong, you'll have to cut the whole picture. So if you're not sure of it, draw with a bold pencil. You get various HB pencils. You can get even 4B, 5B, 6B pencils, which have more bolder and which will be easier to draw with. And if at all you make a mistake, you can erase it. But if you are confident, if you have practice enough, you can directly use black pen or black sketch to draw these things. And then later you can add a bit of colors. So now we need to talk about Little's area, Woodruff's plexus, and retrocolumnar vein. So we already saw what Little's area is about. It is an area in the anteroinferior part of the septum where it has a plexus formed by four different arteries. So these four arteries form a part of the internal as well as the external carotid arteries. So the four arteries that form the Kieselbach's plexus in the Little's area are the anterior ethmoidal artery, the septal branch of superior labial artery, the septal branch of sphenopalatine artery, and the septal branch of greater palatine artery. So when a question is asked on the Little's area, you need to draw the picture of blood supply of the septum with special attention to the Little's area. We had already shown that in the previous picture. So why is this very important? Because this area is the most common site of nasal bleed, not just in children but also in young adults. The two reasons are, in children, it's mainly because they pick their nose, they put their finger inside their nose whenever it's itching or something, they pick it and then it starts bleeding because it's just right here. And also due to the drying effect of inspiratory air current. So once it bleeds, what happens is there is a scab that gets formed that causes a bit of crusting, a little bit of foreign body sensation, discomfort, and we again tend to scratch it. Again, the scab falls off, there is raw area, there is again bleeding. So that's why people have recurrent nasal bleeds due to the little's area. And then you have your retrocolumnar vein. If you remember, columella is this part of the nose. If you lift up the tip of the nose like this, between the two anterior nares, what you find is a columella. So just inside, there is a vein that runs vertically downwards just behind the columella on either side, and it crosses over the floor and goes to the lateral wall. So this causes venous bleeding in young people. So we saw that little's area as well as a retrocolumnar vein causes bleeding in young people. Now you have something called the Woodruff's plexus. If this is your inferior turbinate and this is the anterior end of the inferior turbinate and this is the posterior end, slightly inferior to the posterior end of inferior turbinate, that is a posterior end slightly inferior to it, you have a plexus of veins called the Woodruff's plexus. It causes posterior epistaxis in adults. So we saw the applied anatomy. It's really important. We shall be discussing more about the bleeding from nose in the epistaxis section. So before you discuss about epistaxis, you need to know the vascular anatomy of nose. The blood supply of septum, the blood supply of the lateral nasal wall, Little's area, Woodruff's plexus, Kisselbach's plexus, and also retrocolumnar vein. I hope this video is useful to you and it helps you form your concepts right. Thank you.